Mike will be monitoring the chat, and Shawn is happy to take questions throughout the presentation. So I will now pass it over to Shawn for the remainder of our session today.
Hello, everyone. I don't know if the message just popped on your screen, but I did just start the recording for this meeting, so we'll be recording throughout and be making the video available. I'll be passing that off to Mike and Sasha, and they'll find their way to make it available to all of you. So yes, as Sasha said, I am Shawn Brule. I work at Statistics Canada on the Canadian Community Health Survey. I have worked on the survey for many years and have actually been primarily responsible for the last two CCHS pumps being put together and released. So it's hoping I'm the right person to give you an overview of how to use it. I'm going to be sharing my screen so that I can connect to my workstation where I can show you all the components of the CCHS pump and go through both an overview of the survey as well as how to use the file itself in various degrees of detail. So I just want to confirm. Sorry, a million things open. Start at the beginning. Okay. I can just, if I can get a confirmation from somebody that, oh, that's not good. Okay. That my screen is visible, should say CCHS annual component.
It looks like you're good to go.
Okay, cool. Now this is an old presentation. I'll have to update the date for today. I have a lot to talk about, both the overview of the survey, the design, and how it came to be and what it is, as well as what's happening to it right now and the coming years. And then I'll get into the nitty-gritty of the two most recent CCHS pumps, primarily the 2017-18 cycle, which was most recently released last year, but also just a little bit about the 2015-16 pump. There's content differences, a little bit of design differences, and I think it's important just to know that from one pump to the next, we change what content we make available to users, and sometimes disclosure control rules will be made more severe from one year to the next. So you may notice one variable available one cycle, and the next time you get a pump that's not there. This all has to do with the process of how we put the files together. So, this is working. There we go. So the overview for what I'd like to start with is just the design of the survey, talk about the content through the years. I really want to highlight something about the 2015 redesign. This is really important to take note for users who have had access to multiple iterations of the pump, both before and after the redesign, because there were methodological changes that will result in comparability potential issues. I won't say issues per se, but I'll just talk a little bit about what those changes were and why you need to take those into consideration when doing analysis. I will talk about the 2015-16 as well as the 17-18 pump and some future modernizations that will be coming in the next few cycles. Sorry, my mouse wheel's going too fast. The history of the survey, this predates me, so I've pieced together this from existing presentations and documentation. It's a very big survey. There's a lot of information about it. It's overwhelming at first glance, but the survey was really conceived in the late 90s, with the first cycle collecting in 2000 and 2001. It was designed to cover a wide array of health indicators for annual surveillance at the health region level. The indicator framework was conceived as the various aspects of population public health at the time that needed to be surveilled. So health behaviors, health surveillance, so that would be chronic conditions and mental health conditions. Access to healthcare systems, so accessing the medical system and difficulties with that access. The CCHS was conceived originally with two branches, the annual program and the focus content program. Anything I say now about the annual would mostly apply to the various focus content cycles throughout the year. So if you do have interest in, say, the mental health from 2002 or 2012, or the nutrition survey or healthy aging component, most of how to use the annual CCHS pump will apply to those cycles as well. The governing committee for the CCHS is a joint committee between Statistics Canada, Health Canada, and the Public Health Agency of Canada. But we do consult with expert groups in provinces and territories, as well as academics and NGOs to get details about making sure the content that is in the survey is apt for measuring what we're trying to get in the Canadian population. The main objectives are providing health data for surveillance at the national, provincial, and sub-provincial levels, that being the health regions within the provinces and territories. We aim to have a large enough sample to be able to perform analysis on small populations and rare characteristics, and have readily available data so that it's released as soon as we can, so that users can get access to the most recent cycle for their analytical needs. We also have the survey instrument flexible so that as new data needs arise through the shifting landscape of population health data, we are able to update the survey to be able to get those new concepts covered by the questionnaire. The design of the survey itself, we are designed to cover residents of private households aged 12 and over, so we do not cover children in the CCHS. We exclude people living on Indigenous reserves or settlements, institutions, so those are health institutions, long-term care, prisons, religious institutions, etc. Currently, full-time members of the Canadian Forces are excluded at the person level. So a household can be sampled, and if a household member is a full-time member of the Canadian Forces, they are not eligible to be selected, but other household members are. And very remote areas, there are certain areas that, due to cost of collection, we just can't cover them with the survey currently. Overall, though, we do cover about 97% of the targeted population. And we're designed with a sample large enough to provide reliable estimates at the health region level with 2 years of data. The geography is available more on an annual basis, but really to dig down to the HR level, we recommend using a 2-year file, which conveniently the pumps are follow that design. So the health regions are administrative units in the provinces and territories. For Prince Edward Island and the territories, each are designated as their own single health region. For the 2015-2016 pump, data was collected in 104 health regions in the provinces, in PEI in each territory, totaling 108 health regions. This is based on the sample design at the time that we draw the sample to go into collection. It's a fact that as time goes on, the provinces and territories do update their health region geography. We try to stay as up to date with that as possible, either, well, ideally before sampling. If not, it will be in dissemination where we'll make adjustments and allocate the data that we collected to the most recent health region design. So from 1 year to the next, you may, if you're not affiliated with any of the provinces or territories, if you just are a user looking at the HR level, you may notice changes from one cycle to the next, and that's the really reason why. On the pump, the health region is the lowest level of geography available. If you are a user who has access to the microdata through the research data centers, all census geography variables are available. But for disclosure purposes and confidentiality, health region is the lowest that we can go on the pumps. Now that is after some grouping, which I'll talk about shortly. The collection of the survey currently is done by interviewers, with about 20% of the interviews being done in person and 80% by telephone. This does not apply to 2020. We stopped in-person collection due to the pandemic, and we're currently 100% by telephone. We are working as hard as possible to get our survey adapted to electronic collection, and that will start next year. So for anyone interested in electronic collection, that is coming. We're just a little bit late to the party on that. The respondents age 12 to 15 are interviewed alone, if possible, with parental consent, just to avoid any biases by having parents in the room. But we ask consent of the parents to make sure that it's okay. And about 2.5% of our cases are completed by proxy. This is in an instance where a respondent who is selected for the survey isn't capable of answering for themselves due to a physical or mental health condition. We will allow another household member to provide answers for them. Some of the questions we won't ask because as a proxy respondent, there's knowledge that they may not have about the respondent, so feelings and perceptions and opinions we can't collect by proxy. Now, the data is processed after we collect it. This is important to remember later on for when you're actually using the microdata. When we ask a question, there's various reasons why a question may be skipped and needs to be recoded. When we're asking our questions, we try to be as efficient as possible. If we are asking, do you have asthma? And for whatever reason, the respondent refuses to answer the question, the follow-up question, do you use an inhaler? We're not going to ask that because they didn't tell us if they have asthma. We're not going to ask the next question. So any questions that are follow-up to that first one are coded as not stated. These are non-response questions. In some cases, an interview will be halted before completion, but if we've made it 2/3 of the way through the survey at least, we will actually keep that as a partially complete case and code the remaining variables on the file to not stated. So you may be a user and have an inexplicable not stated on a value, on a variable. The interview complete code will indicate whether or not we actually made it all the way through or not, and that could explain why the value is not there. And of course, when questions are not relevant, so maternal experiences, if our respondent is a male, we're not going to ask questions about breastfeeding initiation. Other specified responses when we're asking what kind of difficulties did you have trying to get to your last dental appointment, if we're talking about dental care, we'll allow interviewers to collect write-in responses, and we'll try to recode those as much as possible to existing categories. So as a data user, if you're seeing an other category, it is distinct from the categories that are available. And we have derived variables that are not part of the collection, but of course are coded in processing based on some specifications that come from either an existing instrument or a metric for reporting. So a good example would be the household food security module, where we ask a series of 18 questions, but then we have a method to derive a code to indicate food secure, food insecure at various levels. Weighting for the survey, this is important methodological information. The survey is a sample survey, so each respondent has to represent themselves and others in the population based on how what their characteristics are. The sample weight, WTSM, this is a variable that's available on the pump. This indicates for each record how many in the population is represented by this one particular record. These weights are adjusted for non-response and are calibrated to match population estimates at the health region, sex, and age group level. So non-response adjustment, if we have household non-response or person level non-response, we try to allocate the weight from a respondent who, well, from a record who was sampled that didn't respond to those who did, so that we are representing the full population. And then calibration is a method where we take known population counts from, or population estimates, I should say, from the census at the HR, sex, and age group level, and adjust our weight so that if you as a user are producing the population estimate for males aged 18 to 34 in some particular health region, if you compare that to the census, then you'll get as close as a match, minus a little bit due to rounding, as possible. Now, the content design for the survey, if you're using the survey for multiple years, this information is pretty important to know. Core content is content that's in the survey asked all years to all respondents. These are the main focuses of the survey, so information on smoking, perceived health, physical activity. These are the main health indicators that we're collecting on annually. The theme content, if you're a user and the home care module is on the file 1 year and it's not there the next year, this is part of the theme content design. This is why. These are topics of interest for discussed between the Population Health Data Program, so our partners Health Canada and Public Health Agency. On an annual basis, content comes in, all respondents are asked these questions to answer, emerging data needs. Now, optional content, any module that has existed at any point in the survey's lifespan currently is available for provinces and territories to select, up to 8 minutes worth. So as a data user, when you're looking through the questionnaire, it's really important to note what type of content you're looking at. And if it's optional, what that means is that the data that you'll have on the file only applies to certain provinces or territories. So if you are trying to make inference based on your statistics, you just have to be aware of what provinces or territories you're actually covering. There's documentation I'll show you shortly how to find out where it applies to. There's other content that's not currently available through the PUMF, the Data Liberation Initiative, using the wrong acronym there. If you are a user who would potentially be able to get access through a research data center, these additional types of content, buy-ins, rapid responses, or subsamples would be available through that option, but unfortunately not through a PUMF. This is our content plan before 2015, before that redesign that I alluded to earlier. I don't know who's on this webinar right now and to what degree of communication you've had with Statistics Canada. Some of these materials have been circulated at past events. So I don't know what's out there. I just wanted to show it just as a good example of what we have. But also I wanted to warn, we had another content plan made for 2015 to 2022. I have a big red "don't look at it" sign on here, just because I don't know how widely distributed this document actually became. This was planned for with the best of intentions, but when we had a new government come into power, there was a huge change in the data priorities for our partners. And actually, a lot of the themes that were put into this long-term content plan had to be reassessed. So we always make a point of just mentioning, if anybody has this document, please don't use it. But it's a paper copy and it's out there, and yeah, you know how those things go. The actual content plan, we haven't printed new versions because, like I said, we have emerging data needs. Our partners at the federal departments are very responsive to changes, and they use the CCHS as a way to get information on these data topics. So we're currently going, unfortunately, not with a long-term content plan, but on a 2-year basis, negotiating what modules are making it into the survey and what are not. So this will apply to the 2015-2016, and I'll have another slide for 17-18 for the 2 pumps that are the most recent ones that are available. These slides are only going to show you the core and the theme content that was collected. The optional content, there's other documentation that will show you all the modules that were available, which provinces had them. But I just want to show this to explain a really important point. That'll, I was going to say for later, but part of the 2015 and 2016 design, we changed our sample allocation for the territories in such a way that we are only representative over a 2-year cycle. So if you're a user of the 2-year pump, you'll notice that the territorial respondents are on the file, but there are modules that are marked in the 1-year theme slot here that won't be on the 2-year pump because for the territories because they weren't collected over 2 years. It's a little tricky, but yeah, essentially, if it's not collected over a 2-year cycle, we can't put it on the pump because it doesn't apply to the population that the file contains. So it's just important to know which content you're looking at, what document you're looking at. You may look at a 1-year questionnaire and be led to believe that the Health Utilities Index HUI module is available on the 2015-16 pump because it was collected in 2015. Well, unfortunately, no. It was only collected in 2015. The file that you're going to get with the 2015-16 pump is that full 2-year file with representing the population over that 2-year period. So if the questions are only asked for half the year, it doesn't apply. For 2017-2018, we had some similar content that was kept as core. Well, we have the same core content. New theme content collected over 2 years. We have the 1-year themes in the provinces. We actually were able to get an agreement with the territories to have the same 3 cancer screening modules asked. We call it a 1-year theme, but it actually was collected over 2 years in the north. So on the pump, you will actually have this data there. It's just important to look at the columns for 17 and 18 and make sure any content that you are trying to analyze is in both years for it to be on that pump. Okay, other changes related to the 2015 redesign. So this is pretty important for any users who are doing comparisons over time, but with cycles from earlier. We did change our frame from an area-based frame to a geography-based frame to a household survey frame for adults. So we have a frame of all households in Canada, we sample, then we randomly select an adult within there. And then for youth aged 12 to 17, we make use of the Canada Child Benefit. This is a benefit that all children from birth to age 17 are eligible for. So it was deemed as a very good coverage of that population and allowed us to do direct sampling of youth, which increases the quality for analysis for this particular type of respondent. Whereas in the past, they were selected randomly from the household roster. So quality-wise, you're going to get better quality estimates with the CCB frame-based cases. How that affects estimates, these are kind of deeper methodological questions, but it's something that you have to take into account all the changes that have been made to the survey when you're doing analysis and know that they could have an effect on estimates in the back end. Maybe more importantly, the collection method, we switched to much more telephone interviews starting in 2015, including all youth respondents exclusively by telephone. So if you're looking at variables that you think have, or that are known to have a mode effect for person versus telephone-based collection, having more collection being done by phone could lead to changes in estimates from one cycle to another. Sample allocation, maybe not as relevant unless you're looking at particular geographies. Because we allocated at the health region, and the health region is kept as up to date as possible with what the provinces are using for administration. This shouldn't affect pump users because the health region is the variable of the geography of control on that file. This maybe more applies to other users. But of course, the territorial coverage that I just mentioned, we only collect in half the communities 1 year, half the communities in the other within each territory. So you need a full 2-year cycle to be representative of the North. So I've got a list of all the historical pumps. that have existed. There were a few single-year pumps created. We've stopped doing that with the 2015-16 and 17-18 pump, mainly due to the territories not being included in a single year, but also due to added disclosure risk of having overlapping files with the same respondents. So unfortunately, for the foreseeable future, we're only going to be having 2-year pumps. Okay, I had that content plan that was available before. This is a little bit more relevant to the pump itself. This lists the content that's available in the 2015-16 pump, the core content. My next slide will show the theme. There are differences between what's in our content plan, what we collect, and what goes on the pump. Some content modules or some variables within content modules are deemed too sensitive or too disclosing to be included. And so there may be questions in the questionnaire that are collected, but you don't have a variable for it on the pump. That's the reason why. We try to document this with the pump itself to show you or to explain why we're not releasing certain variables. But just to be aware that if it's in a questionnaire, it doesn't mean that you're going to be able to access it with the microdata. The core content for the 2017-18 pump, someone might catch me that I said core content is the same every year. Because of the change in our long-term content plan, there is some content that's considered core that actually has changed from before being collected every year to now, but the main modules, general health, height and weight for getting obesity estimates, smoking, these modules will, I guess I could be held to account for this, but will never change. But our plan is to keep these as annual variables, or Statistics Canada will find another vehicle for them. But the CCHS will keep these as core, certainly going forward. Theme content, so I mentioned these are specific modules of interest that are collected over the 2-year cycle. I won't go into details of what all of them apply to. I think it's pretty clear. The star next to some of these modules just indicates that there are certain variables within these modules that were deemed too sensitive and were not included on the pump. So a good example, suicidal thoughts and attempts. We do have lifetime suicidal ideation, but we don't go further than that on the pump. So if you're looking for actual attempts, that's not on the pump. And the theme content for the 2-year file is available here. Okay, the design for the pump. I don't want to go into too much details here. I'd like to actually get to the documents a little bit faster. So I'm going to skim through this a little bit quicker because I know I'm taking a lot of time. But essentially, we take all the records from the master files and put them on the pump. We do keep some geography variables, the health region of the respondent. For any user of the 2015-16 pump, we did an experiment where we added a geospatial indicator called the Canadian Active Living Environment score, CAN-ALE. This is a census dissemination area-based measure of population density and intersection density and a few other measures of geospatial indices. It's an open source geography concept, but it requires access to the dissemination area geography, which is not on the pump. So we did an experiment, we linked it to the CCHS, and then we dropped all the other geographies and kept this CAN-ALE score on there. So it gives you that as an option for analysis. This was a one-off experiment for the 2015-16 pump. It actually increased record suppression for content variables for the CCHS, and so it was deemed that it was too much of a risk for existing pump users, and so for the 2017-18 pump, this variable was not kept. This just indicates the number of records, number of variables. If you open up the file, you can certainly see this. I'm just going to skip this. I'm going to skip this. I'll just mention that the CAN-ALE variable that is on the 15-16 pump there is a document included with that particular microdata file. So if this is a measure of interest, there is documentation on what it is and what it can be used for with that pump. But I will skip that now. Disclosure control. So I've mentioned this once or twice. This is a process where we go through all the records that we collected and all the variables that we have and ensure that you as a pump user or any pump user cannot identify a respondent. The pump is available under an open license, so anyone can get access to it, anyone can distribute it and reuse it. So we have to make sure that no particular respondent can be identified. So there are a few controls that we put into place. For the geography, we grouped some health regions together. So there were 19 health regions that got regrouped into 9. The 3 territories used to be grouped in pumps before 2015, but we were able to get permission to release them separately, starting with the 2015-16 pump and 17-18 pump as well. The respondent age is a good example. On the master file, you will know the exact age and years of a respondent. You can actually get their date of birth, but of course that's too disclosing. So on the pump, you don't have the date of birth, you don't have the exact age, you just have an indication of what age group the respondent falls into. So 5-year age groups starting at 20, and then 3 distinct age groups for the younger youths, younger adults. And other indirect identifiers are grouped or masked to prevent disclosure. So on the master file, we'll have a variable to indicate the country of birth for a respondent. On the pump, you'll only know if a respondent is Canadian born or not. Just as an example. One new thing for the 2015-16 pump and onwards are a set of bootstrap weights. I'm going to go into this in a little more detail later, what those are. I just want to say that previous pumps did not have the bootstrap weights. So methods for estimating variance for your statistics was not something you could do directly with earlier cycles of CCHS. But starting with 15-16, the bootstrap weights are available, and I will go through those shortly, how to use them. And that's my last slide for this presentation. I want to talk about the pump package next, what's available with it, so the data, the bootstrap weights, and the documentation. And I'll show you the Beyond 2020 files that are available with it. And then I'll jump into some SAS and how to produce some statistics with 2 different methods in SAS.
Hey, Shawn, I noticed
Yes.
for me your video is it's not freezing. It sort of is a bit choppy. So I don't know if the slides were transitioning slow. It may just make sense for you to turn off your video.
Oh, sure, absolutely, yeah. Thank you for the tip. I'll do that. Okay. Okay, so I'm just going to go back up a level. So I'm going to be talking about and using mainly the 2017-18 pump. Pretty much everything I'm looking at now will apply to any cycle of the pump, with the exception of the bootstrap weights, which, as I just mentioned, are only available starting with the 2015-16 cycle. But otherwise, the documentation, the data, the Beyond 2020 files, those are so far produced for every pump. So yeah, anything I go through now, you can take this and use it for any of the cycles. So as a pump user, when you contact Statistics Canada and get a copy of the pump, we'll send it to you through an electronic transfer. I know, like Sasha, your organization gets this file and makes it available to your users through your program. I don't know if you maintain the exact file structure and documentation and folder structure, but I'm going to go through it as we have it. But the names of the files will tell you what they are and what they can be used for. So what you'll get with the pump are the sets of bootstrap weights. There's not much to look at in here. There's some documentation as to what they are. I'm not going to open these right now. That just talks about what the bootstrapping process is. You'll get bootstrap weights file, and the survey microdata file as well. We have a SAS file, so if you are using SAS, it's already coded into a SAS data set, so you can just assign a data library here and use that file directly. We have a text file that can be used with layouts that are included for SAS and SPSS to read it into either of those statistical softwares. You'll notice the .dta file in here. This is a recent experiment where we created a Stata data set for the pump. This is new. This wasn't included with dissemination. If there are any Stata users who noticed that and are eager to get it, we can talk more after this presentation. It's something that Statistics Canada didn't previously make available with pumps, but we've been getting the access to be able to put them together. So I can talk about that a little bit later on, just in case there are Stata users out there. Oh, sorry, back too far. The data folder, again, there's not much to see here. This is the actual survey microdata though. Again, SAS data set is available, a flat text file which can be read in with layouts, and the new Stata file that we created. What you'll get with the layouts for the microdata, you'll have a whole bunch of SAS or SPSS layouts and cards or formats and labels. Each one will do a different thing. Essentially, the only thing you really need, and I'll get to this when I go through my demo, the layout, the record layout to read in the flat text file and tell you which variables are which and what length they are. Beyond that, we have a formats file available. So if you want to run your process and have formats already applied, we have pre-existing ones to tell you if a 1 means a yes, or if a 1 means had a doctor, or whatever else that code could mean for each particular variable. And we have some standard labels available for each variable on the file. When you're using the microdata, the variable names are as intuitive as we could make them, but they're limited to 8 bytes. So a variable name may not mean anything to you, but you could apply these labels so that when you're doing your analysis, you know exactly what you're looking at. But I'll always tell you to start with the documentation folder and open up pretty much everything. The main thing you want to start with is the user guide. I'm not going to go through this, but I just want to tell you that it's here, and it will tell you most of what I already talked about with the overview of the survey design. Oh my goodness, this is slow. The survey design, what's new from one cycle to the next, the content structure, everything I've gone through so far today will be covered in here in more detail. But if all else fails and you just want to know more about what the survey is and how it came to be, this is your Bible of what to come back to. It's also going to be important later on when you're doing data analysis for the section on guidelines for tabulation, analysis, and release. So rounding guidelines, weighting guidelines for tabulation, that kind of thing. So yes, you have to use a weight to be representative of the population. What rounding base do we recommend that you use? You know, you're not going to say, 2,342 people had asthma. You're going to round to 2,300, that kind of thing. And of course, quality guidelines. So when you're producing a statistic, you need to have some degree of a quality indicator with it to tell you how reliable is this for the analysis that you're doing. So we have some guidelines to tell you need a certain number of respondents. You should look at the variance, you should produce a CV and look at what that CV is, and what threshold you would want to use for a good quality estimate, a marginal quality estimate, and then an estimate that you may choose to use, but we'll have a guideline in here saying if an estimate has a CV above 35%, we ask that you put a note on it saying StatsCan does not support the quality of this particular estimate. So you can do it, but because it's your pump, you have it now, but we'll just, we have this note here saying that, no, this is not a good quality estimate. How to arrive at a CV to actually look up what the quality of an estimate is. This chapter, I will go through it. When I talk about the CV tables, this will be important, but of course it's here. You can use this to come back to as a point of reference because the CV table document is very valuable if you're not an advanced user. If you're just using Beyond 2020 and producing a cross tabulation, coming back to this and how to get a CV for any estimate you produce with Beyond 2020, this will be very valuable. And we have a few appendices that are useful as a data user. The content overview from one year to the next, the geography. This is for the master and share files. There's a separate document for the pump, so this may be not quite as valuable, but here, Appendix B, the selection of optional content by province and territory. Oh, I've opened the 2018 user guide, I'm sorry. Okay, this says 2018. I've opened the wrong user guide. There should be a 2017-18 table. You will have that with your pump, of course. But it'll be the same table showing all of the modules that were asked and which provinces and territories they apply to. So a check means they had it, a blank means they don't. So yes, you as a user, you'll see a module and a questionnaire and say, oh, perfect, I want to look at dental care, and you've got the pump. So if this is the 2-year pump, you look at it and say, great, I can produce an estimate for Canada. Well, actually, no, you're missing Northwest Territory. So it's not fully representative of the Canadian population, it's a subset. And it's more severe with modules that have very little selection. So diabetes care, for example, just in Newfoundland, Labrador. So this table, the correct table for 2017-18, I should say, very important to look at so that you know the data that you're looking at, who it applies to. Close that user guide for now, and I don't want to go to the CV tables yet. Sorry, I'll go back to the folder. Okay, I should have opened the complement user guide. Okay, so the user guide is your Bible. As a pump user, this is your Bible appendix. This is little bits of detail as it pertains to the pump itself. You should have a look at this before you're doing anything with the pump for the first time, just to understand that everything that's said in the user guide applies to the master and share files. This will tell you what's changed for the pump. So this is the reference to tell you how we converted. So the things I've talked about with grouping health regions. I have this in one of my slides. Optional content suppression. So due to grouping of the health regions, optional content that's not common to each health region or each province, since the optional content is now done at the province level, has to be in both cycles. So if we did a consultation and Ontario decided to include the problem gambling module in 2017, but not in 2018, we won't put the problem gambling module for Ontario on the pump. It has to be in both years because it needs to be representative of the population over a 2-year cycle. So this is just here to explain that principle. And of course, disclosure control. I mentioned this in my presentation. You're not going to get the full master file. There are treatments that are done to it to make sure that respondent confidentiality is protected. This doesn't tell you precisely what it is. We don't give away the recipe because even some of the details themselves are confidential, but just suffice to say, if you don't see it, doesn't mean we didn't ask it, it's just that we couldn't necessarily put it on for disclosure control. And the bootstrap weights, I've already talked about that, so I won't go over it again until we get back to it. I just want to show this appendix. So here's the health region grouping that applies to the pump. This is for the 17-18 pump. I believe it's the same as for the 15-16. I would have to check to be certain. But as you can see, the health regions that were collected and released on the master file are not kept on the pump. So in Newfoundland and Labrador, for example, Western Regional and Labrador Grenfell Regional were grouped together. Smaller health regions with a smaller population, increased risk of disclosure. So these regions are grouped together. When we do the grouping, we try to put health regions together that are both geographically close to one another and also characteristically close to each other. So we look at things like the weighting distribution and the population characteristics. Sometimes, though, there are, you'll say Labrador Grenfell is a more remote area with its own particular characteristics. Unfortunately, it's a disclosure rule. The grouping has to happen, so we try to do it with the best, with the best intentions and group things together as logically as possible. So as you go through this part of the document, if you are looking this up eventually, this is really important to know the codes that are on the file and what they apply to on the pump and which regions are included. This one particular health region you'll notice is blank. North Quebec Health Region. This region is too remote and too unique to be included on the pump. So the respondents that we have for that particular region are not included. So it's just an important note when you're doing analysis. We're still representing 96% of the target population. The population here is quite small. But yeah, this is just an exclusion that you should make note of, especially if you're going through and talking about Quebec specifically. You'd want to know, okay, for the pump, you are excluding this one particular region. And I'll just very long document. Just reiterating one more time. So the territories, you will have access to microdata for each territory distinctly on the 15-16 and 17-18 pump. If you go before 2015, you will not. They were grouped together as one single health unit, just due to the population size. But we were able to do prove that the disclosure control would be safe for 17-18 and 15-16, and now give you access to those distinctly. I'm going to close that. And the next document I'd like to go through. I'm going to skip the quality assurance guidelines. I mentioned them. It's in the user guide. It's reiterated here in a standalone document. Before you do any statistics, just have a read through. This is really important information, especially if you are a beginner user. If you're a seasoned user, this might come as second nature, but it's just good to know that it is a sample survey, and so there is a degree of quality with every estimate. This will help you understand what quality you should be keeping in mind when doing analysis. Okay, so when you're doing microdata analysis, you want to know a particular concept for a particular population. How do you know what to do? There's a few different documents that you'll want to have open when you're actually using the microdata, either directly in SAS or SCADA, SPSS, or if you're using Beyond 2020. There's a lot of variables on the file. So to know what's what to look for, there's a few different ways you can go through. And you should really be looking at all of them kind of in conjunction as you're going through your analysis, because there's bits of information that one document will give you that the other will not. So I always like to start with the questionnaire, just to know precisely what question was asked and who the population it applies to. That information will be available in the data dictionary as well. But just logically following through a flow of a questionnaire, to me, that always feels a little more natural than just reading a technical universe statement note, which I will show you momentarily what that is. But let's just go through and I want to show you the layout of what the questionnaire is. We have all the questions that are asked included in this document. Some of these questions aren't actually variables. Some of them are like introductory texts or interviewer questions. So there's some stuff in here that you'll say like this is the variable or doesn't mean anything to you. That's okay. What you want to look for as you're going through is the heading for the module. I'm going to skip this entry component. Sorry, put our table of contents in the wrong spot. Where is it? Here we go. Sorry. Okay, table contents after we have some of the questions. This will list all of the content modules that were included for the particular year in the order that the questions were asked. And I always find that to be really important to take into consideration too, as to why you may have some non-response. I mentioned at one point about partially complete cases. The 2/3 cutoff point for our survey where we keep a record is the primary healthcare module that is in the user guide. But just I'll say it out loud here so maybe you'll remember it. Primary healthcare, anytime after that, if a respondent drops off collection, we keep it. Code all the remaining variables to not stated or not applicable if we know that it's not applicable. And keep the case as a partially complete. But this will tell you generally what kind of questions were asked for a particular year. So if you're interested in a particular topic, you can use this. It's unfortunately not hyperlinked within the document. But you do have the module name if you want to take it and look it up. I'll use PHC actually. Okay. So the questionnaire document gives you a lot of information about the design of the application and how it was asked. There's a lot of stuff in here that may not mean anything to you. The key thing that you really need to look for are the questions as they relate to the variables, and I'll get to that in just one second. So let me just go to the key one. That's one of our main indicator variables here. Okay, so do you have a regular healthcare provider? This is like one of our main indicators for CCHS about who has access to healthcare and who doesn't. Well, do you have a healthcare provider is one of the key questions that we use to track that. So this is a question that we ask. There's yes response, no response, don't know, refuse. This is collected over the telephone, so this isn't read out loud to a respondent. But if a respondent says, "Well, I'm not telling you that," the interviewer would key in refusal, or if they say don't know, don't know. These flows, based on the question responses, help give you information about why subsequent questions are asked or are not asked. So, of course, if someone says no, going to question 25, what are the reasons you do not? That makes sense. Yes, we don't ask this question, so that not applicable code that I mentioned at one point would apply to these cases. So have your questionnaire open. Open up this other document, which is the CCHS Pump Data Dictionary. This will list all of the variables that are available on the file. Oh boy, this is going. Okay, my apologies for the lag here. I really hope this is not worse through Teams. I'll use my search function to try and skip that. Okay. This will list all of the variables that were asked, the record layouts, where they are on the file. If you've already read this into SAS or SPSS, that's maybe not as relevant. This is really just about the flat file itself. The concept for the variable, and then the page number for this document where you can find it. So I'm going to look for PHC 20, which is on page 328. Okay, so all the variables that are included in the data dictionary come from a question or from a derived variable. And they'll all be displayed with a few important pieces of information. The variable name, one of the most important things. So when you're looking at the microdata, you're looking for PHC20. That's the variable that you'll see the column heading in SAS when you've read it in the Beyond 2020, which I'll get to very soon, or whatever statistical software you're using. This is your guide. This is what you're looking for, is that variable name. The concept, what is it that you're actually looking at, and what does it represent? So when it's a question like this, it's pretty straightforward. Sometimes we have concepts that are very, very specific, where it's a subset of a question. So the follow-up question about why you didn't have a regular healthcare provider. So the concept being no regular healthcare provider, no need. This tells you what the variable is representing in the population. It's part of the piece of information for analysis. It's not all of it. That's why I really urge you to have the questionnaire open as well, because it'll give you the rest of that information as to precisely what was asked. The question text is here. It's copied directly from the questionnaire, and it will be the same. But the layout and the flow of having the questionnaire open with the skip patterns, I find, is maybe a little more telling than just following through this very large document. But if you can use this, then that's certainly adequate. The universe, so this is a statement about the variable that's on the file that will tell you who does it apply to. So it's kind of like saying the target population for the variable. Although this may not actually mean a whole lot to you. Respondents would do PHC equal to 1. You'd have to go back and see, okay, what's do PHC? That's this flag up here, a flag to tell you whether or not we're going to ask the question. It's yes, 1 for every single record. So if you remember back to when I was showing you the content plan and the core content list, primary healthcare provider is part of the core content. The flag will always be 1. It's all respondents are asked it. That's why you have a 1. There's no no's on here. So when you come down here to a universe within a module and it says respondents with the do flag equal to 1, it just means respondents where that module was asked. So if it's core, it's everybody. If it's optional, then you want to have that user guide open to find out which provinces it applies to. As you're going through the questionnaire with the skip patterns, though, the universe statement will change to something more specific. So that flow in the questionnaire where I said, if you don't have a healthcare provider, then we ask the question, why did you not? This universe will tell you, well, this only applies to respondents who said no, they don't have a primary healthcare provider. So if you look at the people who said, yes, I do, 95,943, all 95,943 cases are set to a valid skip. Of course, they did have a healthcare provider, so we do not need to ask the question, why did you not? It's important to understand the universe statement and who is in this valid skip count, because you're talking about, when you're analyzing this PHC 25, you're talking about a subset of the population. So when you're doing statistical analysis, the concept, the flow, this will tell you, okay, I'm producing a statistic that 1.2 million people in 2017-18 didn't have a regular healthcare provider because they didn't need one. And it would be the percentage, this 1.2 million, it's not 3.9% of the population didn't need it, because this percentage is across the full file. You'd have to actually calculate it. It's 1.2 million out of the 4.6 million people who either said yes or no, because it doesn't apply to the vast majority of Canadians who did have a healthcare provider. So this universe statement is really, really important with the concept to just know who you're talking about. The other codes that are in the data dictionary that are really important to see are the non-response codes. So there's the direct non-response where a respondent says don't know or refuse. or there's the not stated codes. Don't know or refuse, like I said, if a respondent just says, I'm not answering that, or I don't know if I have health insurance, I don't know how to answer this question, interviewer will click on one of those options and will code it as one of these codes, don't know or refuse. Not stated, so in this case, pardon me, this is a variable that's at our partial cut point. So you'll say, all respondents are supposed to get this question. They should all have either answered it, yes, no, or they should say don't know, refuse. These 244, this is where the partial cut point of the survey has begun within this PHC module. You're going to start getting cases where the respondents drop off the survey, and you're going to get a certain number of them. I don't know exactly how many it ends up being by the end of the file. It doesn't creep over, I should say it's not over 400 cases, but I can verify that later. But essentially, as you go through, you're going to see some people coded to this not stated code. They just were not asked the question. So we don't know what their answer would be. So we put them as not stated. Similarly, when there's a skip pattern, so where is it here? The not stated for the follow-up question, did you have why did you not have a regular healthcare provider? Those who were partial complete cases will continue to be non-response for the rest of the file. They'll continue to be coded as a not stated. But these people here, these 280 who said don't know and the 39 who said refusal, they're not telling us if they have a healthcare provider, so we can't ask them the question, or we don't know if we should ask them the question about whether what the reason is they don't have one. So the not stated count will go up because of those non-responses. So it's just important to know when you follow the questionnaire flow, some of these skips, the don't know, refuse, or the no, the yes, all of these flows have a different implication for how the variables are coded throughout the remainder of the questionnaire. I'll just get back to that. Yeah. The weighted frequencies, these numbers just represent the raw counts on the file for each particular code, and then the weighted count. So this uses the survey weight and tells you, those 4222 people, if you sum the weights for them, you get 1.2 million people who, didn't need a healthcare provider, didn't have one and didn't need one. The percentage is just the percentage out of everybody on the file. It'll always sum to 100%. Don't just open the data dictionary, though, and use this 3.9% of people didn't need a doctor, because the question only applies to the people who didn't have one. So you'd have to actually take the 1.2 million and the 3.4 million to find out what the total population was, which is the 4.699 who didn't have a healthcare provider. So yeah, you can use this data dictionary to do some basic analysis, but just remember skip patterns, non-response codes, or valid skip codes could mean that you're not, not getting a statistic that really makes sense. And that'll be important to know when you're either coding with the microdata in SAS or Beyond 2020, or if you're just using it straight from the data dictionary here. Quickly want to show the derived variable specs. This is pretty important when you're using the derived variables, because, just come back to the data dictionary here. This goes quickly enough. Here. So this social provisions module has a derived variable called SPS DV so social provisions overall scale. It's based on all these variables, and that doesn't tell you anything. What does this even mean? If you happen to have worked with the social provision scale before, you'll know what this means. You'll just be able to use it at face value. But for a user who wants to know what this concept is and what it truly represents, the derived variables documentation will go into the details of how we arrived at either an actual code, so in this case a score, or a classification of the food security level, or first official language spoken, or what have you, any of these derived variables that are on the file, how did those codes come to be? Those specs will tell you how it came to be. It'll also go into better detail as to what the valid skip count represents, and sometimes what the not stated count represents. So let me just show you quickly what I'm talking about. A good example, I suppose I could use that SPSDB. So this is organized table of contents by module name, and it will show you all of the derived variables that are on the file. Now this includes derived variables as well as variables that are questions that are grouped on the pump. So the health region variable that I showed you earlier, where certain the Newfoundland, Labrador, and the Western regions were grouped together. There's a grouped health region variable spec in this document that explains how it's grouped together. That one's pretty obvious, but some of these variables, how they're grouped together, you'll want to consult this to understand exactly what it is. So I'll go to the SPSDB con. If you're looking at a set of variables within a particular module, sometimes at the beginning, if we've taken an instrument that exists from clinical use or from another survey, there might be an introductory text at the beginning to tell you where it comes from or how it's been adapted for the CCHS. In this particular case, it's not something that has any introductory text for. It's just some specifications as to how the variables are used. It's kind of technically a little bit to take in all at once, but essentially we take the response variables from the questionnaire and do some recoding based on the responses. All of these specs try to make it as explicit as possible exactly what's happening. I'm not going to go through it exactly right now. I just want to show you that the details are here. So you can go from questionnaire to DV and understand exactly how the data was treated and how to analyze it and what it represents. So there's the temporary reformatting in this example for all of the questions, and then a series of derived variables that tell you, okay, if the do flag was a no, we didn't select it, so it was an optional module, these respondents are set to this 96 code. If the interview was completed by proxy, we code it to a not stated. So that's one of the examples where a proxy respondent won't know the information about social provisions, so we don't ask it. So when you're doing analysis, it's important to know, okay, well, this wasn't asked in proxy interviews, so you're missing out on that. I think it's like 2.5% of the file, so 2.5% of the population, just because of that. So it's a bit of a slight non-response bias just because of that. But I mean, if we can't get a proxy respondent to give that information, there's no point in asking it. But a not stated could also be arrived at in a derived variable because one of the input variables was not answered. So maybe they answered, one of the response codes to this question 20, but they didn't give it to 30. In most cases for a derived variable, if we don't have all of the information, we're not going to derive the code. So that's really important to know when you're looking at, say, a module like physical activity, where there's a lot of questions about, how much activity did you do traveling to get around? How much activity did you do in your recreation? How much did you do in other activities? A respondent may give bits of information for one of those questions, but they may have not been able to answer another one. So the overall indicator of physical activity, or in this case, this social provision score, if we don't have all the information, we're not going to code something. We're not going to add a valid value with an invalid, non-response code, because that would skew the estimates and not make them representative. So it's just have this open when you're using any particular DV on the file, just so you know exactly how it was created. I think these are enough of the pieces of the puzzle. I'm not going to go to the errata yet, and I'm not going to go to the CV tables yet. So I just want you to keep in mind the 3 pieces of the documentation for how to figure out what was asked and what they mean. I'm going to go to the Beyond 2020 files first before I get into SAS. I'm wondering if maybe now, I've been talking for a little over an hour, if before I get into the data, if there are any questions, maybe now's a good time to do it. I'll take a drink of water. I will take the silence as a no, and I'll keep on going. So, for every
Shawn, it does look like there's a question that just popped up in the chat.
Okay, perfect.
Are there any plans to put out documentation on calculations in R?
For the best of my knowledge, not with the survey data itself. This will be more something that's happening with Statistics Canada overall. I think there's going to be some documentation made available of how to access the data through R. I know there's more and more use at the agency, but primarily we are all SAS users, and uptake of the new tools is a little bit slower. So I don't have the, I'm going to say no right now, but I know we're going to start picking up on it more and more, and there are data science units at StatsCan that are using it. We just need to connect the dots with the the dissemination people who put information out for data users of how to do this. I will reach out a little bit more, and maybe I'll keep your name, James, and send a response back to the group, and that can be just distributed to you and to everybody, just to say, what's being looked at for other data options. If there's nothing else, I'm going to keep going. I'm hoping. Okay, I'm not sure what that means. Okay, I'm going to jump back into my computer here. Oh yeah, just explaining the technicalities here. If there's any lag here, we're on a weird system where I have to remotely connect to a virtual desktop that is on the internal network. So we have to use a couple, I'm not a networking guy, so like the terminology of like VPNs and VDIs, I don't know exactly what they all mean, but we have to use this virtual remote connection to access our files. So if there's lag, I should have apologized at the outset. It's probably due to this remote connection. Hopefully the recording is clear, so if anything was missed later on, you can come back to it as a reference. But yeah, just we're operating under some weird technical circumstances here, working from home. Okay, in the pump microdata package, we do include a folder here called EXTR 2020. So there's a software called Beyond 2020 that Statistics Canada does have a license with for producing a lot of census tables. It's pretty common that when you're accessing the census profiles for various geographies, you'll have some options to download some Beyond 2020 tables. We make use of a component of the Beyond 2020 file structure, if that's the right word for it, to produce what's called an extract from the survey microdata that basically takes this text file, which is a text file. If you open it up, it's just going to be strings of numbers and letters, and places the variables in such a way that you have this graphical interface listing all the variables by alphabetical order, unfortunately. I wish it's thematic, but listing all the variables that are available on the microdata file. And this allows you to produce some direct cross tabulations in many different dimensions with a little bit of data manipulation so that you can get some quick statistical tables from the CCHS. So this is something we've produced with all of our pumps so far. I don't know actually how many users there are out there who still use it. We're still putting it out there because we keep getting questions about it. I hope it's useful. Yeah, we have a lot of fun putting it together. It's a quick and easy way to get a crosstab of particular variables that are in the file. If you're not a more sophisticated user for SAS or R or SPSS or Stata, any of the software tools that are out there, because yeah, it's point and click and pretty intuitive how to use. But when you first open it, the thing that you want to find in the extract folder, I'm sorry that this is not more clear, the IVX file, this is the main file that you need. Thankfully, alphabetically sorted, it is the first file in the folder. It is the only IVX file. That's the one you want. If you have the Beyond 2020 Pro browser installed on your machine, which I believe you can get directly from Beyond 2020, when you double click on that, it will open up this window, which will give you everything you need to do with the pump. So have this open, have either the questionnaire or the data dictionary, both, all of them with the derived variables, have it all open so you know what concepts you're looking for so that you can start doing your crosstab in a way that makes sense. So if we're going to come back to that PHC variable, let's just do a quick tabulation of that. Every variable that's in the data dictionary will be listed in here. We have linked this to the formats and the labels so that, you know, as you hover over each variable, you'll get the same text that's in the data dictionary to tell you which what concept it is that you're looking at. If you double click on a variable, you'll also get the, oh, that's interesting, the format for it. Huh. That's strange. Hang on. You should get a complete format for it. That's odd that while I'm presenting to you, I happen to find one that doesn't have a complete format attached to it. Okay. So you should have a format attached to the variable to tell you what the codes represent. If in the event that you have one that is missing, the data dictionary will fill in that information. I should mention that the Beyond 2020 files that come with the pump, Statistics Canada used to have a centralized service that would produce these. That's actually been decommissioned, but we kept the code and the process documentation in our holdings in my division. And so my team does produce these for every pump. It's not a standard product for all pumps. I don't think any of the other StatsCan pumps do this. It's not an excuse, but yeah, yeah, I have to look into why that's missing. But in theory, it should all be there. If we come down to that PHC variable, let's get back to my example. You have to scroll through. It's a little tedious. Okay, PHC Q20, we want to look at who has a doctor and who doesn't. This is a drag and drop build to get your tables. Grab a variable and pull it over either to the rows or the columns. Where you put it will really depend on your preference for how you want to format the table. If you're looking at something, say, by geography, say if you're going to look at it by health region, there's a lot of health regions. Maybe you're going to want to look at the health regions in the column so that you're not bogged down with a very wide table that you have to scroll left to right on, if you prefer scrolling vertically. And say you want to look at this variable by some particular characteristic. If you scroll down, let's give an example of the SDC module. So the sociodemographics module, pretty much all derived variables. There's a few just like direct questions. But let's look at the immigrant flag. We could immigrant flag. I'm going to put this up here as a filter that I can look at my tabulation later on for who has a doctor and who doesn't by the immigrant status. I'm not going to do anything right now. I'm going to leave this just a total, but once I tabulate this, you'll see what I mean, where you can do a cycle through the various codes for the immigrant flag. And I'll put a geography variable in here. I'll just do province or territory just to keep it small. So GEOPRV. Okay, so you'll see the headings for the rows and the columns reads in the formats. So you'll see what the tabulation will be once you run it. It'll show all the possible codes that exist for the format of the variable, even if there are no values for a particular format. So for example, province or territory, the format for the variable, just because of our standard processing, we have a valid skip, don't know, refuse, not stated code. That doesn't make sense. The province or territory variable always has a code. Yeah, so just don't be surprised when you see those in here. Nicely, the way to populate the table is your little green light and the traffic lights. This will run from the file and create your crosstab of the values. So if you were to produce this in any other statistical software, you should get the same values as a direct crosstab, weighted crosstab. So this sums the weights of all the respondents. If you want to cross-check this against the data dictionary to make sure that it's the same 31 million, there you have it, 31,274,372, and all of the breakdowns for the crosstab of the yes values, the no values, don't know, refuse, not stated, for the particular crosstab that you're looking at. And as you have this open, you can select your filter variable up here. I'm not sure what the limit is, how many you can put through. I think several. You could fill this the table header with several variables, and you could actually go through and cycle through the various values for each of the filter variables at the top. So if you wanted to put the immigrant flag here, if you wanted to put smoking status and look at, landed immigrants who were smokers by province who had a doctor or not, you can do that with this function. And you can cycle through the various values for that particular data until you get the table that you like. And once it's ready, you can save the table as IVT format wherever your working directories are. Now, before you do that, something to keep in mind, when you're just doing a direct crosstab, let me go back to the total here. This is the entire file. The CCHS program, when my team does analysis, when we're producing tables or producing analytical pieces, we look at the populations of interest and we exclude people who don't belong to the population of interest, so the valid skip. In this case, there are none. We exclude the non-response codes as well. What that means is when you're producing a statistic and you want to look at the proportion of someone who has a particular characteristic in some domain, like who has a doctor in Newfoundland, if you were to produce this table and look at the proportion of this 399,000 out of the 459,000, that wouldn't necessarily match the same tables that Statistics Canada, my team, would produce and release. Our convention is to remove the non-response from the denominators of our proportion estimates, mainly because the item level non-response on the survey is quite low. Not all analysts will do this. It's worth it to keep it in mind whether or not it applies to the analysis you're doing. For pretty much everything CCHS does, a non-response is excluded from the denominator. So if you're working in Beyond 2020 and you wanted to replicate that with your crosstab, you first want to do a filter on the data to make sure that you're not including these don't know, refusals, and not stateds. So you're gonna have to go back to the extract, which there we go. It saves here in the background. Unfortunately, it doesn't save my parameters once you run it. Just quickly do this again with, here, I'm gonna pick a different variable that's has a couple extra details in it. Okay, so I'm gonna do this one instead. So I'm gonna put province and territory in here. I'm gonna put this other variable, perceived stress at work. if you looked at the data dictionary, you'd see that this variable only applies to people aged 15 to 75 who reported that they worked. So there are going to be valid skips. If I just run this, I'm going to have some numbers in the valid skip. There's going to be some don't know, some refusals, and some not stateds for people who don't tell us if they had a job or not. If you want to look at work stress, you want to look at the population who is working, so the people who tell you, you want to exclude the valid skip. And if you want to match our numbers, you're going to want to look at the proportions excluding the non-response codes. So instead of putting this variable in the table as is, I'm going to take it out. I'm going to right click on it and define a recode. No, that's not what I want to do. I'm sorry. I want to apply a record constraint. Sorry, recode, I used the wrong terminology. Recode is something else. I'll get to that momentarily. Record constraint. So I want to take this gen25 variable and drop it in my field and look at my criteria. And I just want to only select the values that are valid responses. So your data dictionary will tell you what are the valid responses. Only highlight those, hit OK. And when you close this, it will save it. So make sure that it saved it here. So it keeps the recode conditions on here that I'm only looking at the people who answered the question. So I'm throwing out the valid skips, I'm throwing out the don't know, refuse, not stated. So if I take this record constrained variable and put it in the table and run it, I'm only going to have values for these 5 columns. Before I do that, I'm going to go through the recode option. So this is something that I got ahead of myself. I'm going to create a new variable because you know what? I know from looking at the data dictionary that the quite a bit and extremely stressful, that's actually what I want grouped together. Those values are more important to me than looking at all of them individually. So you can use this function to go through and define a new code 1. I'm going to put the 1 as all of those who said not at all, not very, and a bit stressful. Okay. I'm going to do a new code 2. These are the ones that are going to be of interest to me that are quite a bit or extremely stressful. Add. And I'm going to do a 3, which I'm going to go back and actually apply a record constraint to and make sure that I don't include them. So these are all my non-response codes. I'm going to create a new field. Okay, create a new field. It'll take a minute or so to do. Well, actually, it's going to take more than a minute. What this is going to do, it's going to add a new variable in my list of variables here that you can now select and drop into your table for doing your crosstab, which will have the constraints and the recode applied to it. So it's only the valid responses and the the 2 categories that you want that are of interest. So the not at all stressful or not very or whatever, and the quite a bit extremely stressful grouped together. So this way you can create an indicator that's of interest to you. This may be the case where you want to look at continuous variable, say, number of cigarettes smoked, it's a continuous variable. There's a lot of response codes. If you just drop it into the table, you're going to get a lot of people with 1, with 2, with 3, but maybe you want to look at who had, under 10 or 10 or more. The recode function will allow you to do that to get something that means something. And if you're a SAS or another software data user, it's the same thing as working with the variable in there and defining a new variable with conditions. So I'm just going to put this new one into my record constraint. I think it would, okay, yes.
Hey, Shawn.
Yeah.
Just a question. So you find this preferable to just taking this out into Excel and summing those variables of interest in Excel, or
that's a good point. You can do it in Excel. I find, just to make sure that it's something that you're not forgetting, or if you want to have like a tabulation that's ready to go. Of course, this doesn't have the format applied to it. Like with this new recode that I created, now you just have a 1 and a 2. You could save, like when you do the recode, there's an option, it's just not open right now. When you're defining the recode, something I haven't really played around with myself, but I believe there's a way that you can define a a dimension definition for it with a format for the 1 and the 2. Probably it would be faster to, just export this into Excel, but this new variable that I've created, this gen25.1, will now be in my extract folder here because I've defined it. It exists as part of my I don't know, beyond 2020 schema, extract schema. It's here as a dimension that is always available. So if you're going to be coming back and wanting to use this multiple times, maybe defining the recode once in beyond 2020 could save you time later on. But of course, if you're going to have multiple users using this from the same location, it can get a little weird where you're all adding new recodes and I guess flooding this folder that's already pretty heavily populated with more dimensions. I guess it's just a matter of preference.
No, that's great. I was just curious. That explains it well. Thanks.
Okay. So you've got this new crosstab here. You have some estimates. You've done the treatment with the dropping the valid skip codes and the non-response codes. You only have the valid ones. So this matches what we would do. You grouped it together to get a variable that means something for you, like if you're looking at this quite a bit or extremely stressful category. How do you know if this statistic is a good quality one or not? So if you're not going to use more advanced bootstrapping procedures, I'm going to have to jump into that soon. I'm going to show you the CV tables first. So this is the quicker and easier way of getting an assessment of the quality for the statistics. This applies to beyond 2020 crosstabs that you produce, or using SAS lingo if you're just doing a proc freak on a variable. That's perfectly valid for producing a weighted number. Proc freak procedures that don't use the bootstrap weights don't give you the proper CV. So if you're a SAS user and use proc means and the CV option, that doesn't actually take into account the sample design, does not give you a good quality indicator. What you should use is this approximate sampling variability tables, CV tables, that's available with all of our pumps. What this is a series of tables by the sample allocation groups, geography-wise, for the particular file. Let me go to the province and territories. What it gives you is a series of potential estimates, estimated percentages, and estimated totals, so weighted totals. This is a the weighted total in thousands for a particular estimate. The user guide that I had open, that I believe was chapter 11, will give you the step-by-step how to use the CV tables with whatever weighted statistic you've produced to find out what CV approximately is appropriate for this particular stat and whether or not you can use it reliably, or if it's something that is something that you want to, drill up to a higher level because it's not releasable. So if we look at this Newfoundland and Labrador number, 47,000 people. What you want to do is you want to go down to the closest without going over numerator percentage, so 45,000 people. If you're just looking at the 45,000 people and you want, or 47,561, if that's the statistic you want to produce that don't have a doctor in Newfoundland. Oh, sorry. This was quite a bit extremely stressful at work in Newfoundland. You would just use this 7.6% as your CV, which is a good quality CV. But because you produce the yes and the no, or the no and the yes, however you want to look at it, you can get an estimate of the proportion. So if you want to release the proportion of this, you would take the 47,000, just look at my calculator, 47,561 out of 2, 508, so you have 17%. So similarly to how you're going down to the closest without going over, you go across to the closest without going over, so 15%. So your estimate of 17%, you can release that with a CV of 7.2. As you're going down, as you're going across, obviously the higher the proportion or the higher the number of the people that are included, the variability goes down. These are all produced by running multiple estimates at each domain. So Newfoundland, PEI, every province, all the age groups for Canada, all the HRs. We use the bootstrap weights to produce a wide sample of CVs and then categorize them into these tables. So it does follow the bootstrapping design. It does follow the sample design. So this is the next best thing to using the bootstrap weights. And you can use this to say, yes, this is a good quality estimate. Now, the CV tables apply to the provinces, HRs, only for geography-wise. If you're doing something where you're grouping multiple provinces together, if you're looking at a subpopulation within a province, which actually we are doing with this particular variable, this might not give you the best representation of what the quality is, because this variable, this Gen 25, the work stress, it actually only applies to people who are 15 to 75 years old and who worked at a job. There are a lot of valid skips in here. So the CV that we get from using the CV tables can still be a little bit misleading. And it may not line up with, say, something that, in a Statistics Canada table. So what you're going to want to do is, if you can, and you have the capacity to use statistical software to do the analysis and get a precise measure of the CVs. I've got 23 minutes. I'm hoping I can get through this all today. I realize I was a little top heavy with the survey overview, but I do think that's really important. I will make these exercises available later. Unfortunately, this presentation comes from an in-person workshop that we've had with exercises, and our methodologists who preside over it haven't had the time to produce a virtual version, so I didn't have them ready for today. But I think if I go through them quickly enough today with you, and I provide to you the exercises for those of you who've never done this, this will be a useful set of exercises just to get some basic statistics down under your belt. Okay, I'm going to jump right into coding. If this is a little heavy for anybody, I apologize. You can, I guess, stop me as I go, but I'm just going to keep on going through with it and try and produce the same statistic that we just did in two different ways, just so you can see what you can do with the pump. So I'm going to take for granted that you understand what I'm saying when I'm using some SAS lingo, but I'll try to explain it as I'm going. Okay, so the pump data exists in a text file. This exercise is set up to read the data in with a text format, so I'll show you that. I'm going to get rid of this. I don't want to keep this. Okay, so the exercise, I really wish we had this set up for virtual. What the exercise was originally set up as was to produce a statistic for people who are physically active in the Ottawa Health region. I'm not going to do that one specifically. I'm going to follow along with this beyond 2021 just so that it lines up nicely with what we've got, just so I can show you the consistency between the processes. But I'll provide some exercises to you that will show you, physically active or not for adults in Ottawa, and you can practice that on your own. So I'm going to create a work file from my pump. I'm going to point to the text file, and I'm going to point to my layouts file. what this will do for non-SAS users, we'll just read in the text and use the layouts to put everything where it belongs and put my variables where I want them. I'm just going to keep everything that's of interest to me for doing the analysis. So the data dictionary, the questionnaire, whatever it is you're using will be critically important to know what the variable names are and what you want to keep in there. For analysis using SAS or SPSS, the bootstrap weights are on a separate file. You're going to need to link it to the pump file using the record identifier, which is the ADM RNO variable. That's the only real administrative variable that you'll need to keep. Everything else, you're just keeping analysis variables for whatever you're doing. So in this case, we wanted to look at the Gen 25. We wanted to look at the province or territory. And when I look at the data dictionary for this particular variable, I'm going to want to keep the variables that are of interest for the universe. So I'm going to keep the age of the respondent and the indicators of this DV work 12. Okay, I chose a bad example. Okay, DV work 12 is not on the file. Okay, follow along with me and I'll explain what I'm doing as I go. So I'm going to keep the age of the respondent, which on the pump is DHHG age. I'm going to keep the indicators of whether or not the respondent worked in the past 12 months, which is actually a combination of two variables in the main activity module, MAC5 and MAC10. But this is everything I need to produce the same statistic as what I had in the Beyond 2020. So I'll just do this quickly. So take a little bit of processing time. It's a big file. The best thing to do for your first step is to just keep the variables of interest and throw out everything else, because what you have in the file are, like G5. There's over 1,000 variables. If you're constantly keeping everything throughout and adding more, you're just gonna, it's unnecessary processing time, in my opinion. So check my log, make sure I've kept all 6 variables. I've got what I want. I can move on and produce my statistic. If I want to calculate just the point estimates for the variable of interest, what I'm going to need is some kind of an indicator variable. If I just do a proc freak on my pump file that I've created, and I'm just looking at that Gen 25, what that's going to give me would be all of the response categories, and I'll put the province in, actually I don't put the province in there yet. All the response categories untreated, so like the record constraint that I applied to get rid of the valid skips, those are still going to be here. They're not stated, so they're going to be here. Also, that recoding where I created a new variable, like that's not reflected yet, obviously. This is just directly all the values, and this is an unweighted frequency. We can just throw the weight variable in here and get the total, but I'm going to do the same treatment as what I did in the Beyond 2020 file. So in this case, I want to create an indicator for my work stress variable to look at all of the non-stress categories together. And then the stress categories together. And then in this case, something that you can do in SAS that you can't really do in Beyond 2020, but it's kind of like the record constraint, is you can just delete the records that are not of interest. If you are only looking at this one variable, go ahead and delete the records you're not looking at. Otherwise, you might want to keep the variable and just set it as a missing value. If you're going to be doing multiple indicators, just keep in mind that somebody who did answer the stress question may not have answered another question, and vice versa. They may have answered the other one, but not this one. So you just have to be careful when you're defining indicator variables like this. Who answered it and who didn't may not apply to all the variables, because there's lots of different reasons for non-response. So what this does is I'm doing my record constraint by deleting the other ones of non-interest, and I'm doing a recode to create my 1, 2 value here at the same time. So I'll throw out my keep statement and rerun this. Rerun my stress value here. These are my codes that I want. This is good. Now this is just my raw frequency values. If you want the weight, simple weight command. The weight variable for the pump is always WTSM. I'm looking at the same stress variable here. And I'll just show you the alignment with the overall. Did it run on that? WTSM. Oh, because I didn't keep the WTSM. Always check your log. So if I try to get my windows here side by side, bear with me. So my not stressed population, 14,881, 2821, and the stressed population, 5.551 million. So you can arrive at the same value. If I threw my province variable in here as a crosstab, I would get my, my Newfoundland statistic here that I could compare. Now this doesn't really do anything beyond what the Beyond 2020 would give you. It's just a matter of preference. You could do the exact same steps here, get this crosstab. You have the values. You can put some options in here to get the extra percents you don't want. But here, here's your 47,000, here's your 17%. You could use the CV tables and conclude, okay, you know what, this is, the CV is whatever it was, 6 point some percent, it's releasable. This wouldn't take into account the survey design. What you want to do is implement the bootstrap weights. I'm going to jump ahead to the exercises that actually go into the bootstrap weights. I have a set of exercises here, and when I give you all the documentation, this will all make a little more sense. We have an exercise set up to show you the wrong way of doing things. Running proc freaks again with variables of interest and running a proc means and generating the standard errors. This is the wrong way to do it. So I don't want to go through the wrong exercise just to show you the wrong way of doing it before showing you the right way. I want to just jump right into the right way of doing it, or our right way of doing it, I should say. So at StatsCan, we have a number of different tools that we use to produce statistics. There are the survey procedures that are built into SAS. So any SAS users out there may recognize the proc survey means. Syntax here, this is a version of the proc means that takes into account survey design. So in this, you can indicate the variance method to take into account the bootstrap weights. You can read in the bootstrap weights and produce a statistic with the correct variance measures taken into account. We also have a set of macros. So this is a set of code that's written that you can just reference in your analytical program that runs some procedures in the background. The macro is called bootvar. If you look on our website, officially Statistics Canada is not supporting any updates to bootvar. However, my center, CPHD, we do make use of these macros still quite exclusively. I feel like it's worth sharing the macros and making that information available. So I will give you this exercise as well, just so you can see what this option is. I just have to say it's not officially included, officially supported by Statistics Canada, just because SAS updates and various versions with new macro languages. Any updates that they may make may break the macro calls. And yeah, that's just something that has to be taken into account. Whereas the survey procedures are built into SAS itself, so they're a little bit safer, a little more future-proof. But I can make the boot file available in case that's something that anybody has seen in the past. But I suppose it is possible that they may break at some point in the future. It happened for SPSS, where we had boot var macros for SPSS, and I think we kept them up to, I want to say it was 2010. And some update was made to whatever version was released at that point in time, and the macros stopped working. So we haven't touched those in over a decade. The SAS ones do still work. We still use them every day. But the proc survey procedures are a lot safer way to go. So I'm going to go through those quickly, just so that you can see what you can do with them. What you need to do is merge on the bootstrap weights first. So I'm going to do that quickly. Sorry. And I'm going to merge my analysis file that I created with the bootstrap weights, and then I'll be able to run this through the bootstrapping procedure in order to get the statistics of interest. So I'm going to merge my pump file with the inboot.bsw by the identifier variable, which I mentioned earlier is the ADM, right, RNO. Actually, I don't have any in conditions here, so I don't need those at all. I'm keeping everybody. So I don't need those. Okay, so what this will do is link to the bootstrap weights file. It's a big file, so it'll take a little while to read it in. What the bootstrap weights are, just quickly, is a set of survey weights repeated 1,000 times, and you can use those to produce an estimate of the variance by calculating the estimate 1,000 times and taking the variance of those 1,000 estimates, and that actually is a valid representation of the population estimate variance. It's a very dumbed down way to say it. I'm not a methodologist, I'm not a statistician. I can provide documentation on what bootstrap weights are if there's anyone out there who is seriously interested in finding out how it's put together. Okay, so I've got my analysis file put together with the bootstrap weights. Just quickly open that to show you what I've got. Bunch of missing values here. These are obviously the ones who didn't answer the survey or answer the question of interest. That's fine. We're not using them. We're just going to use the indicator variable and the bootstrap weights to produce an estimate. In this case, I want to produce my estimate for the stress variable. Sorry, pump BSW. Myself. Var method is BRR. My measures of interest is my totals and my ratios. I'm going to go through my completed exercises just to make sure I get this done quicker. Ratio, CV, do we call in there? I wish I had this prepared in advance for you guys. Okay, my domain variable, this is not in this example, but I'm going to put it in here. So domain variable allows you to, it's kind of like when you're doing your proc freak and you're putting the cross variables between geoprob and stress. This allows you to do the breakdown. It's just, you can provide, I'm not sure how many domains you're allowed to provide, but cycling through all the possible values and getting an estimate for each one. The rep weights, so you have to tell SAS what the weights are on the bootstrap weight file. Like I said, there's 1,000 of them. So specify the BSW1 to BSW1000. My variable of interest, here is my stress variable, my survey weight. I joined the microdata file with the WTSM to the bootstrap weights file. You'll notice that there's a copy of the survey weight called FWGT. It's the exact same variable. In this case, I read in the text file, which formatted this at 2 decimal places, whereas the bootstrap weight file, I read it in an actual SAS data set, which doesn't have the decimals truncated or rounded to 2 decimal places. So you're just going to notice some slight differences if you use one versus the other. But I mean, you're talking about, yeah, down to the 1,000th decimal place. So you can specify either the FWGT or the WTSM variable as your survey weight. Yeah, and lastly, you want to look at a ratio of the stress variable versus the total. Now I'm going to have to actually define the total because it's not on my microdata file yet. So I'm going to set it up here, but it's not going to be you're not going to have it right away. I'm going to have to add it onto the file. So before I run it, I'm going to have to define it. So what the total does will, when I'm creating this ratio here, it will sum up the weights for all the records, sum up the weights for all the records with the stress value, and give me the ratio of the total. Now, I just want to show you that it's important to make sure your total variable is actually the total population of interest. So if I just set a total variable to 1 for my denominator, it will actually take into account all respondents in Canada, which is not what I want. I only want the total for people who answer the stress question. So I'm going to define my total variable based on the stress equal yes or no. Now, there's one other thing I want to do. Maybe I'll just leave it wrong for now, and then I'll correct it to show you what, yeah, what this is going to give. So if I'm feeding in a numerical variable into this procedure, it's going to give me the, oh shoot, I have to close this to modify it. Oh, of course, I went one step too fast. Okay, so if I run this on a stress variable that's 1 or 2, when it's going to run through with the weights, it's actually going to take into account the 2s as a valid value and the 1s as a valid value, and it's going to just sum the weights times 1 for the people with 1, 2 for the people with 2. That's going to give me something that doesn't actually make sense. So I'm kind of showing you the wrong way to do it. No, I said I wasn't going to do that with the other exercise. I'm doing it here. When you're doing analysis on the health indicators, and you're doing proportions and totals like this, when you're doing proportions, you want to create something called a dichotomous variable. This is a variable that's set up as a 1 for the characteristic of interest and 0 when it is not. Of course, I've got myself in a massive procedure here, so it's going to take a little while. I'm going to have to let this run. So yeah, as it's running, I'm just going to explain that when you're creating the variables of interest, in Beyond 2020, it doesn't matter. You can recode, you can call these variable codes whatever you want and feed it in. It's going to sum the weights by the categories. This is like a proc freak, this variable crossed with that variable. When you're wanting to produce the proportions, here, you produce it, you do the division in Excel or calculator or whatever you want to use. That'll give you something that's valid. In SAS, when you want to include a record, you want to include records that have the characteristic of interest and not all possible values. So in this case, with the stress variable, I would need to have changed my stress 1, 2, and decide, okay, what's my characteristic of interest? Am I looking for the stressed or the not stressed? So if it's the stressed, I would take the values of 4 and 5 and say, if my gen variable is 4 and 5, stress is 1. Otherwise, if it's 1, 2, 3, I want to set it to a 0 so that when the SAS procedure is going through and picking a record and says, okay, this record has a 0, multiply 0 by the weight, well, it's going to contribute 0 to the weighted proportion. So it's just important. I'm sorry, I'm going through the exercise in the wrong way before showing you the right way. And I should have taken into account the SAS processing time before doing that. But yeah, I may have to leave this here because I see we're at 3:30. I wanted to go through this in a little more detail. I realized the risk that we wouldn't have enough time to get into the nitty-gritty of SAS coding. So maybe the best thing to do will be for me to package up these exercises along with a set of slides and send those around to everybody. I think that might be the best option to show you kind of the ins and outs of how you can use the two options, either the bootvar macros or the survey procedures, and how to go through and recode a variable to a yes, to a no, like a dichotomous, how to set these up in a way that will give you the same, tabular output as this with, valid weighted estimates, but then it'll also give you measures of, measures of variance. So you can specify to give a CV, you can specify in the procedure to give a confidence interval, standard error, all the measures that you may need for deducing conclusions that make sense or not, with a better quality than the crude method of just a straight crosstab and using the CV tables. Yeah, I think I'm stuck in a big SAS job here. I might want to leave it there.
Shawn, if you could package up the files and a PowerPoint presentation that we can share with participants today, and then keeping in mind that the meeting is recorded too, so people can go back and use this as a reference for the future.
Precisely. I think, yeah, before going spend more time drilling into the data itself, I think maybe, do you have more questions from anybody? I know we're starting to go over time, but I'm happy to stay on for a little longer.
Yeah, there's definitely a lot to digest from today's session. But if you're okay with it, Shawn, we can share your email, or people can get in touch with myself or Mike, and we can pass questions along to you at a later date if they come up as people are reviewing what we went over today.
Okay, that sounds good. I'm going to stop the recording now because I don't think there's any questions.